Hello and welcome to Prenatal Yoga and Pregnancy Q&A with Jessica. Today we're doing a special class for mamas-to-be who are having sciatic nerve pain or who have sciatica. So sciatica is a nerve caused from pressure or irritation to the sciatic nerve, and the sciatic nerve starts in the lower back or lumbar, and the nerve runs all the way down past the buttocks and down the back of the leg. So it can cause pain all the way through the lower back, buttocks, and can radiate down the back of the leg. The pain can be dull, or it also can be sharp, and it can range from mild to severe. Some women also feel numbness and tingling, or sort of like a pins and needle as well. So sciatica in pregnancy is a little bit different than sciatica in non-pregnancy, which can be from osteoarthritis or some sort of bone disorder, degenerative disc disease. It can be from a bulging disc in the spine. So you do want to check with your doctor and make sure that you don't have one of those other problems, and that your doctor or your physiotherapist or chiropractor says that it is safe for you to do stretches and yoga to help take some of that pressure off the nerve. So those are the stretches that we're going to work on today to help take the pressure off and alleviate some of that discomfort and that pain. So I am currently 24 weeks pregnant, and so all of the stretches and exercises today are safe for all trimesters of pregnancy. I'm going to offer some different variations and modifications for third trimester when your belly is a little bit bigger, and make sure that you listen to your body, and if something feels painful or not right, make sure that you back off or that you stop, and we always want to make sure that we are safe first. So we will get started. So you can just find a comfortable seated position. I like to sit on a block to have my hips up a little bit, and we'll just start with some easy shoulder rolls, so bringing your shoulders around and back, just starting to warm up all the muscles of the back. And once that starts to feel a little bit warmer, we can go the other way and go forward. And just whatever feels good, starting to warm up those muscles. And we'll place one hand on your shoulder, and you can tilt your head to the side and roll it around and switch sides. Again, just kind of moving your neck however feels good. Starting to pay attention to your breath, taking some deeper breaths. Good. And now we'll move into on all fours. We're going to do cat position. And so you want to have your wrists under your shoulders and your knees underneath your hips. And we're just going to stay in a neutral spine here. You'll also want to make sure that you're activating your inner core muscles and that you don't have any coning here to prevent diastasis recti. And if you do, then you would want to avoid this position. But if you're able to activate your core, then all fours should be okay. And so on an exhale, we're going to round out our back and go into cat position. And inhale, coming back to a neutral spine, and rounding to cat, and inhale, coming back. And if you want to add more complexity to this, when we're exhaling out, we can actually do a pelvic floor contraction, and inhale, and again Kegel, exhale, rounding out the back. Good. And we'll do 3 more, and stretching out your back. Inhale, exhale, Kegel, inhale, neutral spine, and one more, exhale, round, and inhale, neutral spine. From here, we'll place our toes together, and we're going to move our knees wide apart for child's position. And so you can slowly just walk your hands forward. You want to have lots of room for your belly there. And you can place your forehead on the ground, or if you wanted to place your forehead on a block or a blanket, if that's more comfortable, you can as well. And we'll take 10 breaths here. So fingers are stretched. Press your palms into the ground. Roll your shoulder blades down your back. If you need to move your hips around here to get comfortable, you can. Feel length throughout your spine. And we'll take one more deep breath here. And exhale. Good. And we'll slowly walk our hands and push our upper body back. And we will go back to all fours. So you can take your knees again underneath your hips. And from here, we're going to do a side stretch. So you're going to walk your hands to one side. And then just as much as comfortable, you're going to sit your hips down and to the other side. So you'll feel a nice stretch all the way through the side of your body, around to the back of your tailbone there. Just however feels good. And then we'll come back up, slowly walk our hands to the other side, and we can stretch out on the other side, sitting down just as far as feels comfortable. Take a couple of breaths here. Good. And walk your hands back slowly until you're on all fours. And now we'll do some hip circles. So we're keeping a neutral spine here and just going forward. And as far as feels good, circle the hips around. You can start a little bit smaller. And if it feels good, you can go all the way back. And stretching out all those muscles. Sometimes a tight piriformis muscle can cause pressure to sit on that sciatic nerve. So we want to stretch that out. And we'll go one more around this way and come back up to a neutral spine, and we'll go the other way. So starting a little bit smaller, and as you're warming up your hips, bigger hip circles. This should feel really good. We'll do one more circle on this side. Perfect. So now we're going to stretch out our hip flexors in a runner's lunge. And so you can either place your hands, if you're flexible, on the ground. If you do want to bring your blocks up beside for a little bit of extra height and support, especially if your belly is getting pretty big, that's fine. And so you can place your hands there, bring your foot out to the side and walk it up. Make sure you have lots of room for your belly, and the blocks go on either side of your foot, and then press forward, press into your hip flexor there, and feel that stretch. So tight hip flexors can throw off the balance in our pelvis. Our pelvic girdle can cause pelvic girdle pain. Just want to make sure that we stretch these out and we have good posture day to day. Take a couple breaths here. And pushing into your hands, slowly coming back, and bring that leg around nice and slowly. We'll move to the other side. You can move your other leg forward, and when you're ready, pressing into your hip flexor and stretching it out. So it should feel good. It shouldn't feel painful or uncomfortable. Just go as far as feels good for you. A couple breaths here. And when you're ready, coming back to all fours. And again, we'll place our toes together, our knees wide apart, and we'll move into a child's pose. Take a few breaths here. We'll take one more deep breath here. And slowly walk our hands up. And from here, we're going to move into a figure 4 stretch. And so you can just move your legs around. And we're going to take our feet straight out in front of us here. And then we're going to take our right leg and place it over top of our knee. And then we're going to place our hands behind us, lean back, and then we're going to inch up that bottom foot to wherever we feel a stretch. So if you're feeling a stretch here, you can stop there. But if you want to bring your leg up, however much feels a good stretch for you, keeping lots of length through your spine. Trying to arch your back, you won't be able to, but that's sort of the feeling. Shoulders aren't coming up towards the ear. And we'll take a few deep breaths here, really relaxing into that hip. With every exhale, try to relax. And a couple more breaths. Last breath here, really trying to relax. This might feel really tight. Great, and we'll switch sides. So slowly inch that bottom foot down. You can walk your hands forward, straighten out your right leg, and now take your left leg and make a figure 4 there. Take your hands back and then slowly inch that foot until you feel a stretch. Lengthen your spine, roll your shoulders down your back, and just focusing on breathing and relaxing. So I've done a modification in the window above. If you want to do this on a chair, if you're farther along in your pregnancy, it's more comfortable, that's absolutely fine. You can do the modification in the chair. And we'll take one more breath here. And slowly inch that bottom leg down. Walk your hands in. Straighten out both feet in front of you. And now we'll come around to face the front again, and we'll do cow pose. So you can leave your right leg tucked underneath you. And I'm actually going to take a block and I'm going to sit on top of that block there for a little bit more space. So take that right leg and then take the other leg and stretch it over top there. And again, in the window above, you'll see the modification where you can actually leave your bottom leg out straight, and then it's not quite so tight through there. Again, it'll be, if your foot is out farther, it's not quite a big of stretch, and the farther that you move that foot into cow position, the better stretch it's going to be. So just wherever you're comfortable, you just want to stretch out and sort of release the pressure off that side. So while we're here, we'll take a deep inhale. We'll inhale left hand up, and we can grab the elbow and just do a gentle stretch there. Take a breath and release. And we'll do the other side. Bring your elbow up and just a gentle pull. Good. And release. And now we're going to switch sides. So you can take that top leg off and we'll just switch our feet there. So tucking now your left leg and either bent or straight in front of you as in the modification, and then walking this around. Perfect. And now we'll stretch our arms out. So stretch it out in front this time. Take a breath. And another breath. And unwind. And other side, other arm across, and just gently pulling. Take a couple breaths here. Good. So now we will move into a seated forward fold. And so you can remove, if you have a block underneath, you can remove the block. And we'll just take both feet out to either side just as far as feels good for you. If you're here, that's okay. If you have more flexibility, you can move your feet back a little bit. You want to give yourself a little bit of a boost, lots of length in your spine. And we'll take our hands out in front and then just slowly walk them over to one side. And we'll take a deep inhale and stretch. Take a few deep breaths. Feet are flexed, legs are activated. Another breath here. And exhale, we'll come back up and walk the hands out in front and gently around to the other side. And inhale, stretch, activating your feet. Knees and toes are pointing up towards the ceiling. And breathe deeply. One more breath. Big inhale in and exhale coming up. And we'll bring our feet into Baddha Konasana or butterfly pose. So again, if you're here, that's okay. Wherever your legs fall, lots of length in the spine. You can even bring your knees up and then put a little bit of pressure from your elbows. And then relax to gain some more flexibility. If you want to walk forward, you can, leaning forward. And coming back. And now we'll take the top of the head towards the toes, rounding out the back. And a couple deep breaths here. Good, and inhale, coming up. And we'll move into a modified downward dog here. So we're going to come around and sit down here, and we'll come back to all fours. So from all fours, we will curl our toes and move into a modified downward dog. You can place your hands a little bit farther out and keeping our knees really bent. You might need to walk your toes in. We can lengthen, so pushing our head between our arms. Feet are wide apart. Knees are bent into a modified downward dog. We'll take a couple breaths here. Deep inhale. And exhale. And from here, we can slowly walk the feet forward. Again, keeping really wide, lots of room for the belly, almost as wide apart as your mat, but the outside edges of your feet are parallel. Knees are really bent, and then you can, if it feels good, clasp your elbows and forward fold and stretch out your spine. And release your hands and roll up one vertebra at a time. And inhale up, look up, and back to namaste. Perfect. We'll step out into a wide leg forward fold. So you're actually going to pigeon toe your toes in a little bit so that your heels are out farther. Lots of space in that lower spine, hands on your hips. Inhale, looking up, and exhale, folding forward. And you can either place your hands on the ground or in the window above if you want to place a block. And relax your body forward. You can stay here or you can walk your hands farther between. And deep breaths here. Spread your toes, activate your legs. Relax your head. Relax the muscles of your face. And inhale, coming halfway up, placing your hands on your hips and inhaling all the way up. Nice. And we will step to the top of the mat. And now we're going to grab a chair, or you could do this against a wall. So I'm going to pull the chair over and we're going to do a tabletop stretch. So you're going to put your hands and then walk your feet back until, so again, nice and wide, until you feel a really good stretch throughout your back, down the backs of your hamstrings. And breathing deeply. Stretching out your hamstrings can really help relieve that sciatic pain. And one more breath here. And inhale, coming up and slowly walking your feet in. Perfect. So we can turn the chair around and we'll do another hamstring stretch. So you can just place one of your feet on top of the chair and inhale up and exhale, fold forward just as far as it's comfortable. And take some deep breaths here. You can have the toe pointed, or for extra stretch, you can flex it up. And one more breath here. And slowly coming up. And switching legs. Inhale up. And exhale, folding over that leg. Deep breaths. Couple more breaths here. And on the next inhale, coming slowly up. And we're finished with the chair. We can move that out of the way. Now we're going to move into Shavasana. So you can grab a pillow, a couple of pillows in the bedroom or a bolster, and I'm going to place them down there and slowly get down. Your knees are going down onto your left side. And I like to straighten out my bottom leg. I can put my leg on top of the bolster there, and I can place my right hand on my right. So fully letting yourself relax in the pose, scanning your body from your toes through your head, relaxing all the different muscles, not controlling your breath, but just watching it. And when you're ready, wiggling your fingers and your toes, taking a couple deep breaths. And stretching your hands and your feet in the opposite direction, and then curling your knees in and pushing up to a seated position. And if you want to grab a block to sit on, you can. And as always, we will take a yoga card of inspiration. So I've got them out here in front of me, and so we'll mix them up. And so today's word for the day is celebration. And so you can take this to mean whatever you mean. To me, I guess this really just means to celebrate this time. Pregnancy, especially this pregnancy, is not easy for me. And so I have to really try to enjoy all the moments that are enjoyable, feeling my baby move and my growing belly, and not focusing so much on how tired I feel, and celebrating what's coming too. There's lots of exciting and joyful things coming up. So I hope you have a wonderful day. Namaste to you, and namaste to the babies. And if you liked this class, please click like so I can know to make more of these types of videos. Bye for now.